So, good day everyone. I'm here to present my case presentation as part of our final requirement in this subject. So, Doc Brian gave us a series of data in which we will going to interpret individually. So, the following given are as follows. He gave us the measurement of each incisors to get the MDI and the scratch point. Also, he gave us the available space. So, available space is the measure of the distance of the scratch point to the mesial surface of the permanent first molar. So, here, he gave us this one. And we need to solve the required space, the space difference, space discrepancy, and the action. So, now that we've known about the given, we are here to know the formula to get the following. So first, the patient is male. So to get the space required, we have here the formula. So for the maxilla, MDI divide 2 plus 12.2, while in the mandible is MDI divide 2 plus 11.5. So to get the space difference, all you need to do is now that we've known about the given, we are now here to know the formula on how to get the space required first. So the patient is a male, so to get the space required, all we need to do is in the maxilla, get the MDI or the sum of all of the incisors divided by 2 plus 12.2, while in the mandible, MDI divide 2 plus 11.5. So to get the space difference, all we need to do is to subtract. So space available minus space required is equal to the space difference. So for the interpretation, we have here -1 to -4, which represents mild crowding, -5 to -9, which represents moderate crowding, and -10 and below represents severe crowding. Now let's go to the data. First things first, we need to solve for the MDI. So the MDI is the summation of all the incisors. So we're going to add 4-2, 4-1, 3-1, and 3-2. So after adding all of this, I got the result of 22.51. So that is now our MDI. So to get the scratch point, all we need to do is to divide the MDI by 2. So I got the answer, which is 11.26. Okay, so I've said earlier that the space available is given. So the following are the space available again. So to get the required space, as I've said earlier in the formula, all we need to do is to divide MDI divide 2, right? So MDI divide 2 is 11.26. So 11.26 plus, in the maxilla, the given formula is 12.2. And in the mandible is 11.5, right? So to get the required space, let's add the following. So 11.26 plus 12.2 is equals to 23.46. The same as the second quadrant because it is also in the upper. So next is 11.26 plus 11.5 is equals to 22.76. The same is in the fourth quadrant. So, okay, let's now go to the space difference. So again, to solve for the space difference, all we need to do is to subtract the available space and the required space. So 18.88 minus 23.46 is equals to 4.58. And 21.19 minus 23.46 is equals to -2.27. And 22.61 minus 22.76 is equals to -0.15. While in the quadrant 4, 22.45 minus 22.76 is equals to -0.31. Okay. So now let's go to the space discrepancy. So the space discrepancy will be based on the answer in the space difference. So if it is in -0.48, as I've said earlier, -1 to -4, it represents mild crowding. Same as the space difference in the quadrant 2, which is -2.27, it also represents mild crowding, -1 to -4. Next, quadrant 3, negative 0.15, and quadrant 4, negative 0.31, in which it represents that the space is sufficient. So lastly is the action. So if it is mild crowding, we need to have space regainer because the space difference is negative 4.58. So based on the notes from the lecture of Doc Bry, negative 1 to negative 4 means mild crowding and needs to have space regainer. Well, if the space difference is negative 2.27, it represents mild crowding also, but we need to have stripping only, negative 1 to negative 2. So for the quadrant 3 and the quadrant 4, the space is sufficient, so all we need to have is space maintainer. So another table is given by us. We are also going to analyze. So the patient is still male, 45 pounds, and the SNA is 79. The SNB is 80. So we will going to know how to compute the A and B in the next slide. So the MLNSL or the mandibular plane is 32. The UILI is 116. All of that is given. Also in here. The tooth 2-1 have distal caries involving the pulp, and the tooth 1-6 and 2-6 has deep-seated caries lesion. The tooth 3-6 and 4-6 were both sound. So the patient has a habit, no? So he has cheek biting habit, and his dental classification is class 3 type 1. So class 3 type 1 means that the patient is in edge-to-edge occlusion. Edge-to-edge. So first, we will need to interpret the data. The SNA is 79. The normal limits is 83.3 plus or minus 3.3. So my interpretation for this is retrognatic maxilla. So in the SNB is 80. The normal limits is 79.9 plus or minus 2.8. So it means that the mandible is normal, it is not prognatic, and it is not retrognatic. Okay, so the A and B, to get the A and B, all we need to do is to subtract these two. So SNA minus SNB is equals to negative 1. So negative 1 means it has skeletal class 3 tendency. So the normal limits is 3.5 plus or minus 2. So the MLNSL or the mandibular plane angle is 32. So the normal range is 33.4 plus or minus 4.8. And my interpretation is normal or it has ideal rotation. So the UILI is 116. The normal limits is 118 plus or minus 7. And the interpretation is normal. So after interpreting all of the following, I've come up with an appliance which is the face mask or the reverse pull headgear. So here is an example of the picture of the face mask. Due to the reason that the maxilla is retrognatic, the mandibular is normal, and the A and B is skeletal class 3. Here. So the face mask should be worn by the patient 12 to 14 hours, and it is nighttime wear and has 14 ounces per side. So the following are my treatment plan. First is the oral prophylaxis. It is very important because it removes tartar and plaque buildup from the surfaces of the teeth. Next is the TFA or the topical fluoride application. So it is done to improve health and reduce the risk of cavities, especially in children. So next one is the sealant. So it is very important because it covers the chewing surfaces of the back teeth and keep out germs and food. So even if the tooth 3-6 and 4-6 is still sound, we need to put dental sealant. So next, for the tooth 1-6 and 2-6, it has deep-seated caries lesion, right? As I've said earlier in the given. So it would need to have a restoration. So for the tooth 2-1, it has distal caries involving the pulp. So we need to have a pulp therapy. And after that is composite restoration. So we don't need to put the crown right after the endodontic therapy because it is often delayed until later teen years due to the large size of the pulp. So next is to have a selective expander, which is the quad helix expander. But we only need to activate the first quadrant because the other quadrant needs to have stripping only. So for the habit correction, we should need to fabricate a buccal shield. And lastly, the reverse pull headgear or the face mask appliance. So we need to perform endodontic treatment to the child. So we need to administer anesthetic. So the anesthetic carpules for the male weighing 45 pounds. For this one, lidocaine 2% with epinephrine. 1 is equals to 100,000. So 1 cartridge holds 1.8 ml of solution. It is equal to 36 milligrams of drug per carpule. So the maximum dosage is 4.4 milligram per kilogram with an absolute max of 300 mg. So if the patient's weight is 45 pounds, we need to convert it into kilogram. So 45 pounds divided 2.2 is equals to 20.45 kilograms or simply 20 kilogram. So now we need to compute na. So we get the child's weight, which is the 20 kilogram, times 4.4, which is the maximum dose, and it is equal to 88 milligram. It is the needed dose. So 88 milligrams divided by the drug per carpule, which is the 36 milligram. So 88 milligram divided 36 milligram is equals to 2.44 or 2 cartridges. So for the space regainer appliance, we have here the quad helix. A quad helix is an orthodontic appliance for the upper teeth that is cemented in the mouth. So the expander works by gently pushing the teeth outward to eventually widen the upper arch. So a quad helix expander is usually given to those who have narrow top jaw, a crossbite, and or crowded teeth. So as I've said earlier, we need to activate the first quadrant only. Lastly, the patient, as I've said earlier, has cheek biting habit. So for the cheek biting habit, we need to have a buccal shield. So the buccal shield can be used to prevent the habit of sucking or chewing in the cheeks. So while it may not address the underlying of the problem, the appliance is very useful to control the habit and allow the tissue to heal. So thank you for listening.